Good morning, everyone. Bonjour tout le monde. Mon nom est Laurier Fagnan et j'ai le grand honneur d'être le président de Canada Choral. We extend a very warm welcome to all of you this morning, and there are a lot of you, which is fantastic. Thank you for being here with curious minds, and it will be a great day. I said good morning, but it could be afternoon wherever you are as well. It's probably very warm where you are, but we'll have a good warm time together here as well. Donc, nous avons prévu une session très intéressante et riche en informations pour vous aujourd'hui. Je ne vais pas entrer dans les détails, je laisserai Morna Edmondson, notre chère présidente élue, le faire dans quelques minutes. Morna et son équipe ont été très occupés à préparer ce que nous espérons sera une session qui répondra aux maintes questions que vous avez alors que vous vous préparez tous à vous réunir à nouveau en chanson cet automne avec vos ensembles. Les présentations de ce matin seront en anglais, mais n'hésitez pas à utiliser le chat si vous avez des questions. We have a very exciting and information-packed session planned for you today. I won't get into all the details as I'll let Morna Edmondson, our illustrious president-elect, do that in a few minutes. Morna and her team have been very busy putting together what we hope you'll find to be a very informative session that will answer many of the simmering questions that you have as you prepare to gather again in song this fall with your ensembles. But before we get into the information portion of this webinar, we'd like to spend a few moments on an important human aspect of our Canadian culture and psyche. Indigenous matters and the Indigenous people have certainly been on our minds and in our hearts more than ever as of late. We at Choral Canada are committed to doing what we can to be a part of the solution. Sometimes there are issues that are more vital to us as a society than acquiring important information, and this is one of those times. So we've invited a very special guest this morning to lead the beginning of our time together. Kim Gucci is joining us live from her ancestral territory in the Clade-Lee-Tenay First Nation, also known as Prince George, BC. We are so blessed to have Kim lead us in an honoring and smudging ceremony, followed by a land acknowledgement and then a drum song. Kim, a very warm welcome to you this morning.
Thank you. Snichalia. Spoozy, Kim Gucci, Clate Lee, Tsaasdi, Bandada Hunzu. My name is Kim Gucci, and I'm wishing you a good morning or a good afternoon, wherever you are. I am here in my mother's home on the Clate-Lee-Tenay Reservation, also known as Prince George, BC. And it's really, truly an honor to be here with you all right now. I am a singer, and so I feel like I'm in good company right now with all of you. And I had a really beautiful chat with Megan yesterday, and we really connected, and it's incredible how we use this virtual space and how the beauty that can come from the space. Like right now, as we are all together in this virtual circle, I would love to imagine that we're in a circle. If you'd like to join me in gathering around this sacred fire, I'm going to light a smudge. And if you're not familiar with a smudge, what it is it's sage. And it has a beautiful aroma and purification qualities. And it's been used by people all over the world. It's been used by indigenous peoples for centuries. And what it does is it brings us back, it brings us into the now. It grounds us, and it helps to purify the energy fields around us. It purifies the mind, the soul, the heart. And as I'm smudging, I would love for you to imagine that this beautiful sacred smoke is wafting over you. Over our minds, so that we can think clearly and come from a place of love and understanding. Over our ears, so we can hear the good in each other and that we can listen with love and integrity. And over our eyes, so that we can see the good in each other. Over our mouths, so that we speak kindly of each other. And over our hearts, so that we can be open and filled with kindness and love towards each other. We're living in a time of so much change in our world that's affecting every one of us. We have never been more unified as a country, as a nation. And I don't believe that we can hide this anymore. The information that has come from the discovery at the Kamloops Secwepemc Indian Residential School isn't news to us as Indigenous people. These are stories that have been spoken by our ancestors, from residential school survivors that have passed, from survivors that are still here. And those stories had fallen on deaf ears for too long. And now the evidence is here, and it is no longer, it's no longer hidden. These children's bodies are as real as we are. And I am an intergenerational residential school survivor. My late father went to the Lejac Residential School, and his experience there changed his life. But I want to acknowledge that as an Indigenous woman, I'm very aware that non-Indigenous people were also affected by the Catholic Church. And there needs to be a lot of healing in our country, in our world, and there needs to be reconciliation, and this is the beginning of that. And I'm so honored to be here, to be able to even have these minutes to be able to share with you and to be able to hold this space in memory and in honor of the children of residential school survivors. So I would like us to take a minute, 1 minute out of our day right now as Megan puts up an orange screen. The color orange has been designated as the color to remember residential school survivors, and it's based on a story by my friend Phyllis Wobstad, who lives on in Williams Lake, and it was her story that inspired this orange shirt which is a national, it's recognized nationally on September 30th. And we encourage everyone to wear orange. I mean, it's the one way that we can show solidarity and that we can show our love and kindness and togetherness, connectedness. And if you're interested in finding out about the orange shirt, I will put the link in the website, in the chat here, as soon as we're through this section of the opening. So could we please all just take this minute to breathe deep into our bodies, to just take a deep breath. And allow ourselves to just feel this space right now as we connect to Mother Earth, to acknowledge our past, but also to acknowledge the future and where it is that we need to go together. Let's take a minute in remembrance of residential school survivors and the children's bodies that have been discovered and that are yet to be discovered. Thank you. Another thing that we can do together as a people that truly, truly matters is we can acknowledge the land. We can acknowledge this place that we all live in and that we live on, that sustains us, and acknowledge the ancestors that took care of this place, of this land for centuries, for us. And let's look at ourselves to see how we're taking care of this land for our future generations. I'm going to share a song because this is the way I know raise my vibration, to sing out, to release. It is also known as the highest form of prayer. And this song is about being on the land. It's about celebrating the land. The song is in my Dakhath dialect, which is the carrier dialect, which comes from my grandmother on my father's side. And the song is translated to, it's a beautiful day and we're all together. We're hunting and we're fishing and we're picking berries. And let's just hold space and send prayers out right now to all the animals, all the birds, all the crawly ones, the fish. That they can find a cool place to sleep and water to drink during this really unusually hot weather that we're all under right now. And take care of each other. Anditzen hun zu Zaya Platzu is del Akatsu den in Ges Kluk Sulches in Ges My Dunie Thank you, everyone. Snachelia. Thank you. Wishing you a beautiful day and everyone to be mindful of each other and to be kind. And I'm so grateful to be here. Snachelia, thank you.
Julia, thank you, Kim.
Thank you so much, Kim. So welcome, everyone. My name is Morna Edmondson. I'm a conductor and a board member of Choral Canada, and I'm here today in Surrey, BC, which is Coast Salish territory, specifically that of the nations of the Katsi, Tsawwassen, Coquitlam, Stolo, and Chemainus. I'd like to ask everyone to stay muted throughout the presentation. Today's webinar will cover two broad areas that singing groups will need to consider when thinking about reconvening in person. We have 4 presentations. 2 are on the current science. First, we have Dr. Juliet O'Keefe. She is an environmental health knowledge translation scientist at the National Collaborating Center for Environmental Health. She's here in Vancouver, and she'll update us on what is known about the physical aspects of keeping the virus at bay. Then we have Dr. Alison Mcgear from Toronto. She is a microbiologist and infectious disease consultant and a member of the Federal COVID-19 Expert Panel. She'll be talking to us about variants and vaccines. We also have in the chat Joan Fernley, a soprano, choral conductor, and creator of the open source Singers Mask project. Following those two science presentations, we have two presentations on legal and communication issues. First, we'll have Alison Trombley, who is a lawyer at Victory Square Law Office in Vancouver, a specialist in human rights and worker-side labor. And finally, Margot Nightingale, a lawyer, mediator, choral conductor, and singer from Yellowknife, Northwest Territories. Megan Gila, whom you met at the very beginning, is Choral Canada's executive director. She is putting a link to the biographies of our presenters in the chat. Today, our topic is only about singing groups restarting safely. We're not covering anything about audiences convening. The format is that we'll have those 4 presentations first. That will be about an hour. You can put your questions in English and French in the chat as we go. Megan will compile them and pose summaries to the presenters for a Q&A session that's at the end of our time. The total time for this whole event is about 2 hours. And following that, anyone who wants to stay and chat in the breakout rooms is most welcome to do that. We won't be coming back to the whole group following the breakout rooms. Choral Canada is recording this session and we'll be posting it on YouTube, publicly accessible. You don't have to be a member of Choral Canada to see that. And we will also send all registrants PowerPoints and handouts provided by our presenters. So excited about the content that we have for you today. I think many of us are here because we're hoping to sing in person in September, and I am with you, believe me. The shutdown in March 2020 was sudden and hard, but I think many of us are finding the restart harder to accomplish because it's in our hands together with our boards. I've gotten good at saying, I hope to, and my plan is, knowing that none of us control the trajectory of COVID. Today, we are not going to be telling you what to do. If you want our opinion, Choral Canada strongly recommends that choirs plan cautiously and make use of the full menu of risk mitigation strategies. You may see other group activities starting around you and have even more questions. There are so many variables: geography, the makeup of your group, the prevalence of the virus in your part of Canada, and how many people in the larger community around you are vaccinated. The virus rules the day, and we've seen that it rarely tips its hand about what's to come. Public health guidelines federally and locally will trump any plans we put in place. The safety of our singers and leadership is obviously the most important factor in all our planning. Since group singing has been so vilified from the beginning, we are all likely to want to err on the side of caution. Hybrid options where some people are at home on Zoom will likely be needed by many of us, and this will be helpful in keeping the whole community together. Transparent communication with our singers is going to be so important. Our 4th speaker today, Margot Nightingale, will be giving us an example of what steps her choir took to reconvene in the Northwest Territories. How we consider the needs of our singers and communicate that we have their safety in mind will be part of each of our pandemic legacies. Our first presenter today is Dr. Juliet O'Keefe, our environmental scientist from the National Collaborating Center for Environmental Health. Please give a warm welcome to Dr. Juliet O'Keefe.
Get my slides going for you here. Okay, good morning, everybody, or afternoon, wherever you are in Canada. And thank you so much for Choral Canada inviting me to present to you today and for the introduction, Morna. I'm joining you today from Ladner, BC, and would like to acknowledge the traditional territory of the Coast Salish people of the west coast of BC, specifically the land on which I am today, which is the Tsawwassen and Musqueam First Nations traditional territory, and they were the stewards of this land since time immemorial. So today, for those who have not heard of the National Collaborating Centre, we are one of 6 National Collaborating Centres funded by the Public Health Agency of Canada, and we each focus on a different aspect of public health, with the NCCEH focused on environmental health, so physical and environmental hazards to health, basically. I'd like to point you to some of our COVID-19 resources because I won't be able to cover everything today. There's plenty available on our website on a range of mitigation measures and understanding transmission risks of COVID-19. There's also lots of other things about environmental health issues, including in extreme heat. So if anybody wants some information on how to deal with this extreme heat, we have some really good resources for you. So for this presentation today, I was asked to give a brief overview of recent research related to COVID and singing in choirs, specifically talk about mitigation measures focusing on ventilation and carbon dioxide sensors. And if time permits, later we can look at some of the other mitigation measures in the Q&A. Time is tight, so I apologize in advance for breezing through some of this, but please feel free to reach out after the presentation with questions by email if something else comes up that you'd like answered. So in terms of the research overview, I'm just going to pick on 5 little pieces of research that are fairly recent. Specifically, I was asked to look at what the International Coalition for the Performing Arts has put out recently. There's also some research out of Colorado State University, and there's 2, and one is an epidemiological study and a case report about recent outbreaks and exposure events. And these are really the things that tell us we get the science in the lab, but then you want to see what's actually happening out in the real world. And some of these give us a good insight to what are the factors that are contributing to transmission events and what mitigation factors seem to be protective. So the International Coalition of the Performing Arts, they have a recent aerosol study that has come out, and it builds on some of the work they did before about understanding how respiratory emissions are traveling outside of the body. So they're looking at both voice and musical instruments. And this study was looking at things such as the plume of respiratory emissions while singing and the effect of masks. They found that masks were very good at reducing the velocity of the plume. So that means your emissions aren't traveling as fast and as far. And also looking at how much and what types of emissions are coming out. So the top image there is just giving you an indication of when you have no mask, the average velocity of your respiratory emissions as they're being projected out of your mouth, and putting that mask on, you have the blue line beside it, and you can see the significant impact of masks on reducing the velocity of aerosol emissions. The figure below looks at singing with and without a mask. And so the red lines are a singer starting without a mask on, and the bars below the looking at different particle sizes. And you can see as singing starts, there's a peak in particle emissions. Oh, pardon me. When you have a mask on, however, if you look at the blue lines, you don't see that same peak emerging afterwards. So that kind of confirms that. This study is bringing this information together to look at also the duration of exposure and what is a good benchmark for understanding how long you should be singing. And they're looking at less than 30 minutes exposure indoors and 60 minutes exposure outdoors as a good benchmark before taking a break. This study is not published yet, so it's preliminary information that hasn't been peer reviewed, but there's quite a bit there. Hopefully it comes out soon. A second part of this study with the International Coalition for Performing Arts, there was a survey of school music programs, and they've just published a summary of this study this month, which has not been put out to peer review yet. What's interesting here is that they were looking at what was happening in school music programs that had returned to operations with recommended or without recommended mitigation measures in place. So they had 3,000 surveys returned from different musical groups, including choirs, bands, orchestras, and that was conducted in April. About half of those reported that there had been a COVID positive student within the group. So there was community transmission going on. Of those, however, they did not find, as according to the survey respondents, that there had been spread within the group. There was only 8 that identified that spread might have happened within the group. 5 of those were choirs. 2 of the 8 had not implemented any of the recommended mitigation measures. But because this is a survey, you don't have the full epidemiological investigation of those cases. So take this with a little bit of caution to start with. The study uses the results of the survey to come up with a risk of infection from singing in choirs of 1 in 1.9 million, but I think it's kind of a headline figure. It hasn't really been robustly looked at. I don't know if you can actually take that number away. But what it does show is that for most choirs and musical groups that were implementing good mitigation measures, they were not seeing a huge amount of spread. Another Bio-Aerosol emission study from Colorado State University with John Volkins. This is really adding to the existing research out there on particle counts and particle production during singing versus talking, and understanding the differences between men, women, adults, children, etc. It's a really good detailed study, again, waiting publication, but there's a fantastic webinar, which if you really want to look deeper into what they have done, I'd recommend it. I've put the link there on the slide so you can have access to that later. They've also done a comparison of mask types, including 4 vocal masks, to compare breathability, filtration efficiency, etc. So it's quite useful to have a look to compare. Not all masks are created equal, so have a look at that. As I mentioned, there was a couple studies that looked at what was happening out there in singing groups and other emission events, transmission events. In the Netherlands, singing groups had gone back to normal operation in July 2020, and they had some general advice, which is the recommended measures there under RIVM, which is the Dutch authorities. In September, about 70% of their choirs had resumed practicing. So that was close to 17,000 choirs had gone back to practicing. And between September and October, their case counts had gone up about 10 times. Now that's not necessarily anything to do with choirs going back. That just happens to be community spread was increasing rapidly. So this study looked at 6 clusters where there had been COVID outbreaks within choirs and looked at the attack rates. So the attack rate means the number of people that became infected out of the total number of attendees. And these were quite high, which caused some questions about what was going on in these specific clusters that caused transmission to occur. And if you look at some of the factors that might have contributed, in Holland at that time, no masks in public places were required. So these choirs were not wearing masks. There was also not a good deal of information on the ventilation. It was mostly a few doors and windows, if that, in these locations. Mechanical ventilation not present. There was also some contacts in and out of the event, so shared travel, carpooling, and contacts socially outside of these events. And notably, in 4 out of 6 of the reported cases, they noted directional airflow or drafts in the room. So there was some type of ventilation, but it was blowing into people's faces. So those are possible factors that might have had an impact. The recommended measures from the International Coalition of Performing Arts includes masks, time limits as well. Those durations of maximum 30 minutes indoors were all exceeded in the Netherlands cases. So those events were anywhere from 60 to 90 minutes. So that could have also factored in. And finally, I just wanted to highlight this case report from Australia, where there was a church soloist who was singing in a choir loft, which was above the congregation. And he was singing over 3 different days while he was infectious. And he had 4 60-minute sessions on 2 of those days and 2 60-minute sessions on 1 of the days. Nobody was wearing masks, either in the congregation or the singer. What was strange was that he wasn't close. He had no physical contact with any of the congregation, and the rest of the members of the musical ensemble on the choir loft were uninfected. In this case, it looks like masks not being worn could have been a factor. Inside the building, there was no mechanical ventilation or fans, no open windows. Apart from people opening and closing the door as they came and went, there was no fresh air coming in. But as we look at the cases that appeared, they're all in one side of the church too. And it looks like there's a possibility of directional airflow here too, which may have just been natural currents that occurred in this church. There was also a long duration of exposure, over 60 minutes. So this just gives us a few insights into the types of things that could have contributed to transmission events. So moving on to the focus on ventilation and CO2 sensors, I'm going to speed through this a bit, but it can get a bit technical if you really want to know the details and deep dive into ventilation, but we have some really good resources and previous webinars on our website too that you can access afterwards. So what is ventilation exactly? It is the exchange of dirty air, basically for fresh air. Natural ventilation relying on those natural air currents from windows and doors. It can be affected by outside conditions, whereas mechanical ventilation uses fans, blowers, or extractors to move air into and out of spaces, which could be 100% fresh air or partially recirculated air from inside. Ventilation rates are usually expressed as air changes per hour or liters per second per occupant. And if you were looking for recommended levels, usually for schools, it's around about 3 air changes per hour, up to 6 for offices. In comparison, in a person's home, it's usually less than 1 because people are not actively ventilating their homes. In contrast, on a plane, you might have something up to 20 on an airplane, which is very well ventilated. Ventilation can reduce transmission risk by actively removing airborne infectious particles and diluting that dirty indoor air with clean air to reduce the concentration of infection particles. But ventilation does not solve close, short-range transmission of droplets and concentrated aerosols when people are close to each other. What is not ventilation is air conditioning systems that have no removal of dirty air or return of fresh or treated air. Fans that are recirculating air only are not ventilation. So a ceiling fan that is just stirring up the particles is not ventilation. The ventilation is the active removal of dirty air and replacement with clean air. Some portable air cleaners could be considered to remove contaminants from air. So are they ventilation? They can supplement ventilation with some clean air, and most portable systems on their own do not constitute ventilation because they are quite small and usually undersized for the space they are treating. So if you're using them, you have to be aware of the limitations in terms of the capacity of air they can treat. Installed air cleaners in a system, in an HVAC system, can provide a bit more in terms of high quality filters that can filter air that's being recirculated or UV treatment systems. Something to be aware of with anything like air conditioning, fans, is that directional airflow, which we've seen transmission events occur as a result of directional airflows in restaurants in China, in Korea, and elsewhere. So just be aware of that. So how do you—
Juliet, we'll just ask that you speak up just a little bit. Some
Sorry.
people are having a hard time hearing. Thank you.
Okay, thanks for that feedback. Just next is how to approach assessing the ventilation in a space. And what you want to do is start with what you do know. You know the occupancy that you're going to have in your group. You know the duration and the activity type. Look next at what are the ventilation assets. Are there opening windows, doors, extractor fans? And what are the ventilation liabilities? So what could cause a problem in that space, being enclosed, no windows, directional airflows that you're not sure about? So what you don't know, you can ask a building manager. Ask them what the air change rates are if they know. Ask them how much of that air is fresh air or recirculated. And if there is recirculated air, is it treated in any way through example, a MERV 13 filter, which is the recommended level of filtration to remove particles, or UV, something like that. And if you have more than one space, rank your space based on the level of risk. If the risk is unacceptable, move somewhere else, outside, or see if you can enhance any of those assets or reduce the liabilities. Some additional points to think about: still choose outside over inside if you can. Obviously, that's not possible all the time, especially when it's super hot or super cold or super wet. Choose ventilation of any kind over no ventilation. And if it's only natural ventilation, think about cross ventilation. So windows on either side of the room to get a bit of movement. But be aware of the directional airflow. If you can have any say on the type of air supply that's coming in a mechanical system, see if you can increase the outside air supply where possible, and avoid recirculation of untreated air where you can. And check for those drafts and directional airflow, and think about where you're positioning occupants. I'm going to just kind of fly through CO2 sensors because there's been a lot of questions on this. Basically, how they work is exhaled breath contains CO2. And so that can give you an idea of, over time, how exhaled air is accumulating in a space based on the number of occupants, level of activity, how long you're spending there. So they can give you an indication of declining air quality and more shared air in a space as CO2 accumulates. That can help people raise awareness of maybe taking an action, such as opening a window or some other, taking a break from the space. What CO2 sensors can't do: they can't detect COVID, they can't eliminate transmission risks, and they're not a proxy for COVID transmission risks, but they can give you an idea of what the quality of indoor air is. Some of the challenges: what to do when you see a CO2 sensor reading. What is normal fluctuation? What are the thresholds that you're going to look at? And many of the guidance documents will recommend something around 800 ppm. So background levels of CO2 naturally in the air anyway are around about 450-ish. So if you're getting up to 800 and above, you can see that exhaled air is accumulating in that space. There's a lot of products out there. There's fixed products that hang on a wall, portable. So what is better for you? You want to be careful about being too reliant on a CO2 sensor as a substitute for thinking about ventilation clearly. So what to look for sensors that have a range suitable for the indoors. Look at sensors that might do averaging over time rather than a point in time measure, because there will be fluctuations in a space. Air moves around and people move around. Something with a data log can help you observe changes over time. So if you're working with a group regularly for 60 minutes and you see that every time you're in that space, you're exceeding the limits, see what happens if you reduce your time in there to 45 minutes or 30 minutes, something like that. Or see what the effect of opening windows is, or changing how you move in that space. You don't want to place a monitor near a window or ventilation supply because it'll be getting in fresh air. You won't see what's going on in the room. You also don't want it too close to an occupant because then you might get a bias of too high. And anything that has an open flame like a gas burner or stove will also produce CO2, but that does not translate into exhaled air. So be careful about that. So if you do use a sensor, what kind of actions might you take? Open a window, take a break, reduce occupancy or high intensity activities, or you could think about using an air cleaner. One caution about using an air cleaner is it won't reduce the CO2 levels. So the air might be getting cleaner, but you might not be detecting that on your sensor. So I think I'm going to stop there because of time constraints, but we can come back to some of these afterwards if you like. And thank you. And if you want to select any of these resources, they'll be available in the slides that are shared.
Thank you so much, Dr. O'Keefe. Next, we have our epidemiologist, Dr. Alison Mcgear. She is a microbiologist and infectious disease consultant, and she's the one who's a member of the Federal COVID-19 Expert Panel. Welcome, Dr. O'Keefe.
screen shared appropriately. Right, are you seeing my screen, or are you seeing?
Yeah,
Yes.
we see, but we still see your slides along the
Just see the
side.
slides.
So if you start it,
How's that?
you'll want to switch to the other screen.
I want to switch to the other screen. I think I'm going to do that. How's that?
There you go. Perfect. Thank you.
Okay, thank you. Thank you very much for having me, everybody. And you can yell at me afterwards, because I'm completely conscious in the setting of the pandemic that what I'm going to say will be unsatisfactory. I can only apologize for it. It's a pandemic. And nobody, unfortunately, said that pandemics were going to be easy or simple. But let me try to frame what I think is coming at us and how we might survive it. Before I start, let me acknowledge that the land I am talking to you from is on the traditional territory of many nations, including the Wendat, the Anishinaabe, the Haudenosaunee, the Mississaugas of New Credit, and the Métis Nation, and is still home to many Indigenous people from across Turtle Island. I am grateful to have the opportunity to work and to live on this territory. Okay, so what's coming with COVID? Let me start by just pointing out where we are with the vaccination program. If you, like me, are obsessively watching the numbers, we're at 76.6% as of this morning of persons over the age of 12 with 1 dose, and 32.7% people with 2 doses. It's going to take us another 2 weeks to get up to 50% of people over the age of 12 with 2 doses. The reason that these numbers are critically important is that we're in a race with Delta. Okay, so COVID is switching to the Delta variant. That's the variant that originally came from India. It is more transmissible, more virulent than the Alpha variant, which was the one that came from the United Kingdom, which was more transmissible and more virulent than the original variant that we had. So we know as the Delta variant takes over, that transmission goes up and illness becomes more severe. We also know as vaccine levels go up, the transmission goes down and disease becomes less severe. So we're walking this very fine line of trying to make sure that we reduce public health restrictions as quickly as possible, while not bringing on another wave of COVID that gets our healthcare system into trouble. That, of course, is a very difficult thing to do because we've never had to do it before. Okay, there's a lot of unknowns about trying to do this, and so every province is doing it a little bit differently, and all of us are anxious about where we are and what's happening. So the good news, although in some ways increases the uncertainty, is that we have other countries and other places to look at. So let's look at what's happening in 3 other countries that also have high vaccination rates. So one of the, however grumpy we are about the chaos that is our vaccination rollout, and it is really, we're not doing a good job, but what we are getting is a lot of vaccine into people. We have higher vaccination rates than anybody except Israel, and we're catching up quickly in the 2 doses. So the United Kingdom has been running much higher case rates throughout almost the entire pandemic. They went into a very hard lockdown with the UK variant in January and February. They drove their case rates way down, but they've now released a lot of restrictions. And at 50% with 2 doses and 64% with 1, you can see their case rate climbing really dramatically. However, it looks, and I say looks, like the hospitalization rate is not climbing as quickly. And this is one of the critical uncertainties. If being vaccinated reduces the severity of illness so that nobody is hospitalized and nobody dies, we don't care nearly that much, right? It's quite all right to have a whole lot of COVID cases as long as it just makes you sick for a couple of days and then you get better. The hospitalization rates in the UK are not climbing as quickly as the case rates, but remember that there's a gap between hospitalization rates and case rates, right? You get exposed to COVID, takes on average 4 or 5 days to get sick. It takes another week before you get hospitalized. It takes a few days after that for that hospitalization to get into the public health system and be recorded. So hospitalizations lag cases by quite some time. So this is one of the critical issues that we want to be watching, is how well protected is the UK against hospitalization. United States seems to be holding on at the moment. So despite the fact that they have a lower one-dose vaccination rate than the UK and about the same high dose, and none of us know why that's true. That could be that the US has been using mRNA vaccines and the UK has been using AstraZeneca. Looks like AstraZeneca is a little bit less effective against the Delta variant. And so maybe there's more transmission. Might also be because the UK got the Delta variant first. Okay, the UK and Canada have much closer ties to the Indian subcontinent. And so the amount of Delta variant in the US lags well behind what it is in the UK and Canada. So maybe they're just not going up yet. Okay, another thing to watch. And if you saw the news this morning that I got, California is already going back to masking indoors because of the spread of Delta variants. So the US might just be waiting. And then if you look at Israel, Israel had essentially no cases except travel-related cases coming into quarantine after their 2-dose vaccination program. There, if you look at their overall vaccination rate, it looks relatively low at just over 60%. They have a much younger population than we do. So 62% of the population is more than 90% of adults. And so they had very high vaccination rates in adults. They were well down. And then they released the quarantine and they released the travel restrictions. And when they did that, Delta variant moved in and started to go up. So they've got a case rate that looks just like Canada's now, mostly in teenagers, a number of school outbreaks and a number of schools that have closed and some restrictions that are coming back in Israel. So we can watch this go on over time. And here's kind of the balancing act, okay? The things that will determine what happens in the fall are on this list. The current PHAC modeling and the Public Health Agency of Canada modeling has been stellar, okay, this pandemic, so we should probably believe them, are that we're going to be fine over the summer, but when we go back to work and get it back indoors again in September and October, there's going to be a fourth wave. It's current predictions, not going to totally stress out the healthcare system. So it won't be as bad as wave 3, might be like wave 2, okay? But there's a whole bunch of uncertainties that go into that. So if our vaccination, it's done assuming an adult vaccination rate of about 80%. We can drive it up to 90%, things will get better. We don't quite hit 80%, things will get worse. We don't know what's needed for herd immunity. Herd immunity is a simple thing to say, but a really complex thing to describe because of course our population is not the least bit homogeneous, right? Very different contacts, very different environments of contacts, really hard to know how much difference there is in herd immunity between 80% and 90%. Maybe some, but it might be a lot or a little bit. We don't know how well people are going to be protected over time. It's looking honestly like protection over time is holding up really well. So it's not on my list of worries, but still might come into it. We still don't know for the Delta variant exactly how well it protects against hospitalization and death, against less severe illness, against transmission. We know that your antibody levels from vaccination are lower to Delta than they are to other variants, so we might lose protection over time. We know that Delta variant tends to infect younger people, and there have been a number of clusters in schools, in other places, and so it may be that this variant is transmissible enough that it can be propagated in the 15% of us who are children under 12 and are unvaccinated. Or maybe it can't be, okay? All of those things are up for grabs. And of course, there's no rule that says that we're not going to see a new variant, right? We first heard about the UK variant at the beginning of December, took over in March. So we first heard about the Delta in March, it's taking over in June. So we might hear about a new variant sometime in the next few weeks that would be a problem for us in October. And finally, of course, there's the things that we're doing with non-pharmaceutical interventions, so public health measures, and how quickly we reopen, how quickly we let people come in contact with each other, what we say about masks and other precautions, how quickly we open our borders to other countries will also drive that balance of public health, of control of the virus versus letting the virus multiply. So there are a really large number of uncertainties going into the fall, and that makes it really hard to know what we're going to say about what precautions we need and what we can do. We'll come back to what I think is going to happen in a moment. Now, the other thing that you need to know about children and children's choirs is that we're not going to have vaccines for kids until October or November at the earliest. We were hoping for earlier, but the truth is that we can't use vaccines in kids under 12 until we have the results of clinical trials, and we won't have them now until October. We don't know the burden of the inflammatory disease and post-COVID in children, and that's critical to understanding how much they will benefit from vaccines and whether we should use them. And now, of course, we have to worry about the risk of myocarditis in currently young men, but presumptively maybe boys, after mRNA vaccines. And so we're talking about what is the balance between the risk of vaccines and the risk of disease. For us adults, that's really easy, okay? The risk of disease is much worse than the risk of vaccines. When you get down to 5- and 6-year-olds who rarely get ill, clearly understanding the burden of COVID and the burden of vaccines is critically important to what we do, and we don't have all that data yet. And we also don't know to what extent vaccinating children protects adults, right? Children get less sick, they shed less virus, they may not be critically important in propagating disease to adults, and so we might actually not need to vaccinate them. Probably not true, but it might not be. So we're going into the fall with unvaccinated children under 12 who may be a significant source of illness. All right, so now let's talk specifically thinking about what influences the risk of COVID and impact, as well as COVID itself, if you're going back to singing in person. Starts with what your community incidence is, right? The higher, you just heard Dr. O'Keefe tell you about what happened to outbreaks in choirs when the community incidence goes up. As long as our community incidence in Canada is as low as it is now, things are relatively safe. If it climbs to, 10 times what it is now, that's different. And so how much there is in the community around you is critically important. Then you look at your choir members, okay? First of all, vaccination. Again, we get to a little bit of uncertainty, but what we know now is that vaccination reduces your chances of serious illness by about 95%, maybe more. Probably reduces your risk of having illness that you can transmit by less. Vaccination is great, but it's not perfect. So if you think about it, if vaccination reduces your risk by 95%, if our number of cases per day in Ontario go from 200 to 4,000, and you're going to say that's impossible, but that's actually what happened in March, right? If our number of community cases go up 20 times, then your risk, if you're vaccinated, is the same as your risk if you were unvaccinated when we had 20 times less cases. So vaccination is great, but it's not perfect, okay? So that's one set of, whether or not your members are vaccinated is really important. It's also important what their exposure risk is. If you have a choir made up of healthcare workers who work in long-term care homes, if you have a choir made up of essential service workers, if you have a choir that lives in, from migrant workers that live in congregate living settings, okay, that's clearly higher risk than a choir where people have the ability to keep themselves isolated and stay away from people. If you have a choir that is obsessive about adherence to public health measures, that's lower risk than a choir of people like my son, heaven save us, okay, who just, some days has a little trouble holding on to things. Then you want to worry about the impact of COVID as well. So if you have a choir of 16-year-olds, those 16-year-olds are very unlikely to get seriously ill from COVID. They might take it home and give it to their grandmother. You should worry about that, but they're not going to get very sick themselves. If you have a choir made up of 75-year-olds or pregnant women or people with underlying illness, those people, if they get COVID, are more likely to get serious disease. So your thinking about risk is also about what's going to happen to members in the choir if by chance they got COVID at choir practice. All right, and then we move to what happens at choir, okay? And Dr. O'Keefe's already told you about ventilation spaces, so we won't spend that much time talking about it, but obviously the things that go into risk anytime a choir is singing together in person are how long you're together, right? Really simple. And continuous, right? 2 minutes is worse than 1 minute, 3 minutes is worse than 2 minutes, all the way up. There's no line in the sand. How many air exchanges you have in the room? Not gonna protect you from droplets from somebody right next to you, but may well protect you from people around you and from buildup of viral particles in the air. Whether or not you've got clean air or recirculated air, how crowded you are. So a space that has no circulating air and has 5 people in it is lower risk than a space of the same size that has no circulating air that has 25 people in it, right? It's just simple as, how much people are putting out in the way of particles. How you're maintaining distance and separation. And one of the hard things about distance and separation is you can do distance and separation when people are singing, but you also have to worry about distance and separation when people are driving to the choir practice, and when people are going to the bathroom, and when people are picking up their tea at break, right? So it's not just what happens at the event, it's how you've set it up around it. Won't worry about hand hygiene, okay? And people are going to look at, people always look at me and roll their eyes when I say hand hygiene in the context of droplet spread diseases. But the truth is that your hands go up to your face at least 8 times per hour without you recognizing it. And if I've been standing here with my hands and somebody has been breathing on them, they're covered in viral particles. And when they go up to my eyes, so do the viral particles. So, and better hand hygiene is clearly associated with reduced risks of illnesses that we know are spread predominantly by respiratory droplet routes. So really good hand hygiene. And then finally mask wearing. So dealing with how you're managing practice is this really frustrating exercise of trying to make sure you've done everything that's sensible, not too restrictive, picking the things that you can do and doing your best at them, because that's how you absolutely minimize the risk while allowing ourselves the freedom to get back to life as we know it. So lastly, what do I think is going to go on in September and October? I do think that I think we all think we're going to get through the summer in one piece, because it's going to take time for Delta variant to build up, and we'll probably be okay until September. The critical issue is what's going to happen when we get back to school and work, and as we're trying to get back to something closer to normal. And we probably won't pay for that until October. So I think that choirs are going to be allowed to get back in September and October. School and children's choirs might be an exception depending on what Delta does and depending on how we're managing things in schools. One of the challenges in schools is that a lot of the things we're doing in schools hinge on having classes in bubbles, right? You want to keep your grade 5A bubble together at all times. And if you have a whole school choir, that's one place where, you know, there's like 10 people from 10 different bubbles that might get together, and that might pose a challenge. So I think school and children's choirs will need some very careful thought. I do think that there's still going to be a variety of different public health guidance that we all have to follow, even if it's different from what people next town over are doing. And I think it is probably going to make complete sense that if we are going back, that the risks are going to remain enough that we should be thinking very carefully about sensible precautions, not having choir, but making sure that that masks are worn, that there's alcohol hand rub, that people are taking reasonable precautions to make sure there's not transmission. And finally, I think we got to recognize that that it may get interrupted, that we may sometime in October, November, just have too many cases again, and we may be going back. I don't think into complete lockdown, but I'm sympathetic to the fact that choirs have been perhaps overly vilified, but I think that there may be a period of time, hopefully not very long, in the fall where choirs would have to be interrupted again. Lastly, when are we going to know? Okay, so my dates are, by the end of August, we're going to know how well we're doing with vaccines in Canada. We're going to have better estimates of protection against serious illness with Delta. We're going to have 6 more weeks of watching Israel and the UK and the US and different provinces in Canada, better idea of what's going on. We'll know whether there's another variant coming. We'll know whether there's waning protection in high-risk people. And so that'll give us a much better sense of how safe September to November is going to be, and what we can do. And then finally, in mid-October, we're going to know what the impact of going back to school and work and the cold weather is having on it, and how big the wave is going to be. So I think we can plan now. The decision point for exactly what's going to be done with choirs and everything else in the way of activity is probably going to be at the end of August. Thank you.
Thank you so much, Dr. Mcgear. So much to think about. We are going to take a 3-minute stretch break. It'll literally be 3 minutes. So after that, we have Alison Trombley, our lawyer. See you in 3 minutes. Okay, it's time to start again. Hopefully everyone's back and hearing my voice. We are now welcoming our third presenter, Alison Trombley. She is a lawyer at Victory Square Law Office in Vancouver, as I mentioned, specializing in human rights and worker-side labor. And I'll also disclose that she's a singer in Electra Women's Choir. Welcome, Alison.
Thank you very much, Morna, and thanks to Choral Canada for inviting me here today. I'm really pleased to be here and to share what I hope will be some, it's not going to be answers, but guidance of things to think about when you are considering bringing your choirs back from the legal perspective. So I am going to share my screen and get this up. All right. So first, I want to say that I am an uninvited settler on the land that is the unceded traditional territories of the Semiahmoo, Katsi, and Kwantlen peoples. And this land was also used by other Coast Salish peoples. I am in Surrey, British Columbia. In reflecting about that statement and the context of this presentation that I'm going to give today, I think about the groups of people that have shared land, shared space, shared air, and how different songs must have echoed over the nearby waters, and also mindful of what tried so hard to silence those voices, colonizers who brought with them a new and devastating disease. So I think that what we're talking about is a story of history, a story of now, and really a timely thing to think about in all kinds of ways. Because I'm a lawyer and this is a legal presentation, just a disclaimer, I'm not giving anyone legal advice. If you want to get legal advice, go and talk to your own lawyer, but this is going to be general information. So I was asked to talk about a return to choral singing and vaccinations. And within that general topic, I see about two main questions that I hope to, as I said, not answer, but give some general guidance about and provide things to think about when you're considering these issues. And one is, should you ask for and be recording your choristers' vaccination status when you return to singing? And the second question, should you require them to be vaccinated fully for full participation in your in-person rehearsals and in other aspects of what you do? They're two different questions. And so you need to be able to say yes to the first one before you can say yes to the second. And I'm going to talk about both of those aspects. My points do apply across Canada, although there are different laws that affect the different jurisdictions, and please refer to the disclaimer slide. There's also special provisions about children's choirs that were kind of mentioned in brief. The legal issue for children's choirs is the question of consent, parental consent on behalf of singers versus when are the children old enough to consent to a vaccination on their own and stuff. I'm going to leave those questions aside just because it gets too detailed and I don't have enough time. So I'm going to talk about some legislation that applies, some of the legal history that led us to this point, some predictions for the future. They are predictions. I don't have a crystal ball, or if I did, I would charge extra for it. Some practical considerations, and then there'll be some time for questions in the question and answer section of today. I think that any PowerPoint presentation is not very good unless it has a good cartoon. No offense to the other presenters. I'm talking about my presentations. And so the point here is that we don't know what is going to happen. I am making predictions about the future, and that's common to the epidemiological presentation as well, right? So we're just making the best kind of guesses that we can based on science or based on, in my case, the existing case law. Oops. So key assumptions in what I'm going to talk about. Choral singing carries an elevated risk. I don't need to say more than that. Some layers of protection are difficult to implement in certain choral environments. You might need to see faces. Singing and masking is difficult, those kinds of things. I'm going to assume wide availability of vaccinations, because you can't require people to be vaccinated unless that's already available to people. That vaccinations are safe and effective. I think we're there and we know those things. Some people do have bona fide health conditions or genuinely held religious beliefs that would prevent them from getting vaccinated. And I have a star, an asterisk next to genuinely held. And you will have heard of lots of people saying, I object to masks, or I object to vaccinations because of my beliefs. The way that human rights tribunals interpret that is that belief genuinely held? Is it a requirement for your religion or for your personal integrity, for your personal beliefs, or is just something that you're using as an excuse or a reason to kind of get what you want without having that genuineness to that belief? Also, assuming that rapid testing is not commercially available across Canada, there is rapid testing that is happening in other places, and we do have rapid tests in Canada, but we're not at the place right now where you can test people at the door on the way into choir, for example. And also science and guidance in this area is changing rapidly, so it's really important to stay on top of whatever is newly available in terms of the science and in terms of the public health orders and those kinds of things. And of course, I generally practice in the workplace. I'm a workplace lawyer. I represent unions and employees, but choirs have employees, some of them, and some of them have volunteers. Some of them have community members that are involved. And so choirs have all of these different aspects to them. And I hope to try and touch on some of those differences where they apply at law, but I'm going to speak mostly from the law that applies to employers, first of all, because that's what the most law is that's been developed already. Employees and employers like to get into disputes and sue each other, and that's a lot less frequent in terms of people who volunteer. There's also more legislation that applies to employers, but it's all useful guidance to consider. So I hope that's going to be helpful. I'm going to skip that slide just in the interest of time. So talking about legislation, what kind of legislation is out there that applies to workplaces, to organizations? We have public health orders and emergency regulations. We all have to abide by those. They're well known because they're well advertised nowadays. Workers' compensation acts. These are requirements that we maintain safe workplaces, that we have the ability to refuse unsafe work, and that we are taking care of complying with particular regulations. Human rights codes. We all need to be free from discrimination on the basis of age, sex, disability, religion, family status. And Privacy and Protection of Personal Information Acts. So if you're going to be asking for and recording health information about your singers, your volunteers and employees, then you have to make sure that you're holding that information in compliance with those acts. I'm going to talk a little bit about the general Canadian approach to this notion of telling someone what to do with their personal health. This is a case from 2007. It's a grievance. So a unionized employee, or a union sued the employer for asking for a bunch of health information. And the arbitrator said, health choices are traditionally seen as personal choices, and private and personal, made with the assistance of individually chosen professionals that have a relationship cloaked in privacy and confidentiality. The choices that govern those decisions might include things that the employer wants them to include, or they might not. They might include just general feelings about situations or other considerations like how that's going to affect my ability to go for a vacation in the Bahamas. And there may be all kinds of reasons for those choices. So the arbitrator said, you know, it could be indifference, neglect, fear, lack of knowledge, or a lack of resources. There's other language about this as well. So this BC Teachers Federation case talked about a special privacy interest, not just a regular privacy interest, but a special one that attaches to medical information. So we hold medical information at a higher standard. The doctor-patient relationship is the most private, and medical information should not receive broader distribution than what is reasonably necessary. So someone asks you for your vaccination status, that the general Canadian approach might be something like go pound sand. This United Steelworkers case, Fording Coal, confidentiality of medical records is a basic right to human dignity. So in some of these cases, one of them was, or here, an employer can only intrude upon the privacy of an employee if a legitimate business purpose tied to that relationship that justifies the intrusion. So again, setting a really, really high standard. And some of these cases were about employers wanting information from employees about their sick leave, getting copies of their medical files so that they could manage their absence. And one of them, the employer said, well, you know, if we know what your treatment is, if we know what your disease is in the treatment that's being provided, we might have some suggestions for your doctor. We might say, well, actually, have you considered this drug or this surgery? And the general legal approach to that kind of invasion is, no, that's between the person and their physician. The employer can't go and interfere with that. Now, I set that out because it is an underlying framework for how we can think about what courts and arbitrators might do when they see folks who are trying to implement new rules about vaccinations or things about COVID, right? We don't know, there aren't any cases that exist yet about an employer trying to impose a mandatory vaccination policy. But we can look at these prior cases and see, well, this is the starting point, right? So we know that there's going to be a really high threshold for what is going to be permitted. Then we look at the Personal Information Protection Act. This is the British Columbia Act, but similar acts exist across Canada. And you know, this says that an organization can't collect personal information about people or use it or disclose it unless there's consent, or there's authorization without consent, or there's a deemed consent. Now I'm going to put B and C aside because they don't apply to these situations. You're going to have to get consent from your singers in order to collect personal information about them. So how do you get consent? Well, you have to tell them the purpose for the collection. Why are you asking? The name and contact information for a person in the organization who can answer questions about that collection. Or if the person voluntarily says, hey, yeah, I've been vaccinated. You know, they put a post on Facebook with their vaccination sticker. Yep, that's you might have some kind of understanding that that person is okay with the general public knowing about their vaccination status. However, you don't have consent to put that into your organization's database. So be careful about that kind of thing. Organizations can only collect information up to the point that a reasonable person would consider appropriate. So what's this reasonable person? I don't know what they're going to say, right? We have a lot of unreasonable people making a lot of posts on Facebook these days. Is that shifting the bar on what is considered reasonable? I don't know. I can maybe guess. I think that my guess would be no, that the courts are going to use their own kind of reasonable person standard. But again, you have to consider what a reasonable person would consider appropriate. And then organizations cannot provide use the collection of personal information as a condition of providing the service if they're asking for more information that is necessary to provide that service. So again, is it necessary that you're collecting this information? And if it is necessary, then you can use that as a condition of providing the service or allowing your singers to sing in your situation. But if it's not necessary, then you can ask them, but I'm not sure that you can demand it. Workers' compensation. So, again, I'm looking at the BC Act because I'm in BC, but I mentioned this briefly. Employers must ensure the health and safety of all workers and anyone else who is working and present in that workspace. And that includes an obligation to remedy hazardous workplace conditions. All right, so now we're starting to see the tension, right? It's talking about what you can't do and what you might not be able to do. And now we're saying, well, but you have to do these other things. Okay, so we now have to remedy hazardous workplace conditions. What is the risk and the hazard that is posed by COVID? And can that be remedied in other ways? Or do you have to remedy it with vaccinations? Things to think about, right? Workers also are required to remedy or to take reasonable care to protect themselves. And they mustn't pose undue risk of injury or occupational disease to another person. What would that mean? Probably don't come to work sick. It might mean don't get in other people's faces and blow into them, right? Those kinds of things. And then of course, workers have a right to refuse unsafe work. Now, if a worker refuses unsafe work, then you make a call to the Workers' Compensation Board and they come in and do an investigation and say, actually, that work is safe, or no, that work is unsafe. You have to do these things to fix it. Okay, so that's always going to be a risk for your organization. If you say if you're a board and you're telling the conductor that they have to come, we've made a decision, you're going to present, and the conductor says, I don't feel safe, I'm refusing to work. So then there's a process that you'd go through.
Allison, can I pause you just for 1 second for a quick question? Maybe you're going to get to this, but just because of a few questions in the chat. Does this apply to volunteers? Because a lot of choirs are made up of volunteers and you're referring to workers and employees. So if we could have a quick clarification on that, that'd be great.
Absolutely. So really good question. And I did kind of touch on that. I say workers because this is the work that I do generally is talk about workers. The Workers' Compensation Act does have the word worker in it. And of course, it obviously applies to anyone who is paid staff, right? If you do have employees of your organization. It also may apply to volunteers, and the difference between what is a volunteer that is covered on the WorkSafe provisions and who is not is a bit complex. They say that any kind of remuneration could be considered to make someone a worker that would be covered. So there's been things like provision of meals or board can make someone a worker. Provision of tickets, movie tickets or hockey tickets can make someone a worker. It doesn't have to be an exchange of money for services. So someone who you might think would otherwise qualify as a volunteer can in some circumstances be covered by WorkSafe workers' compensation legislation. The other thing to consider, though, is that while those the strict requirements of the Act may not apply, it's certainly good guidance for your volunteers as well. I don't think that any organization that says, well, we're not covered by WorkSafe, and so we're going to allow our workers or our volunteers to perform in unsafe and hazardous work environments. Good luck defending that one, right? So I think that these are useful guidance legislation to follow anyway.
Perfect, thank you. So the summary is that we should be using employment law as a way to be treating the volunteers as well, even if they aren't necessarily included. So we'll just keep moving forward when we're hearing you present that when you talk about employers and employees and workers, that we're also talking about volunteer singers. Great, thank you so much.
Yes, thank you, Megan. So the Human Rights Code, again, I've put the British Columbia language up on the screen, but similar provisions apply across Canada. And in BC, the language is people cannot, without bona fide and reasonable justification, deny services customarily available to the public or discriminate against persons or classes of people for services customarily available to the public because of religion, physical or mental disability. Family status is also there. I've cut that out, but you can't discriminate. So this is for services customarily available to the public. I'm going to touch briefly on Megan's question here because this is the section that is not employment. This is the section that applies to organizations. And depending on the way that your organization is structured, it may or may not be customarily available to the public. Probably your auditions process is available to the public, although membership in the organization may be more exclusive than that. Generally speaking, the human rights tribunals interpret these provisions very broadly and will look at even a private organization and say whether it's complying with the provisions of the Human Rights Code. And you see that in cases like a rape relief organization that provided services to women, women only. And there was a case about a volunteer who wanted to provide services who is a trans woman. The Human Rights Commission did look at that, and it was a private, quote unquote, organization. But providing services to anyone who wanted to volunteer. So you can see the analogy there to acquire that is somewhat exclusive in that you have to be invited to join or choose to join, but it is open to anyone who wants to try and join. There's also section 13, which is specific about employment. So again, for those hired and remunerated staff members. Now I'm going to talk a little bit about some cases, and from these cases that exist in analogous spheres from previous cases, we can kind of see where the courts might go in dealing with COVID. There aren't any cases on vaccination as on its own, but what we do have are cases in this vaccinate or mask area. They're all in the realm of healthcare, long-term care, and primary care. And they were cases where the employers required their employees to be vaccinated against the flu. And if they weren't vaccinated against the flu, they had to wear masks during the flu season. There are a variety of decisions in this realm, and most of them, the decisions tend to be based on how much medical information, scientific evidence there actually was in the case. So one case, the purpose of that policy was found to be just to increase vaccination rates. It wasn't to prevent the spread of disease. And they made that decision because there was no evidence or very little evidence that masks actually limited virus transmission. And so in that case, it just didn't make, whoops. It wasn't, the policy didn't have the purpose that the employer said it did. And so they did not uphold that policy in that case. And then in another case, there was a mismatch in the year between the flu vaccination and the actual flu disease that was out there. And even though those people who had this useless vaccination were able to go to work without masks, they were still requiring masks on people who didn't have the useless vaccination. That didn't make sense to the arbitrator, this policy, so they threw out that policy. But there's other cases where policies were upheld, and in one case there was an actual public health recommendation saying vaccinate so that we can prevent transmission, and in that case the policy was upheld. So there's kind of differing cases based on what information was able to be provided. Interestingly, in British Columbia, in one of the cases that was upheld, that policy, vaccinate or mask policy, was upheld, the government put policy in place and then revoked it and said, actually, this policy isn't working very well. We don't like it. We're going to leave this up to the individual to make their own decisions. So interesting. And again, that's in healthcare, which is a high risk environment for obvious reasons. Then we look at the precautionary principle. This is often discussed in terms of medical decisions, and you know, the idea is let's take the precautions that we need to prevent unnecessary illness and death. So if we can't establish with scientific certainty what's going to happen, that's okay. We're allowed to take precautions against the yet unknown. As you can see, this presentation is a lot of maybe, maybe not. I'm sorry about that. That's just the way the law works right now. So, you know, recognizing we're in a dynamic and evolving situation, We need to constantly reevaluate, take reasonable precautions based on the available evidence at the time. So this case is actually about COVID, and it was about a masking policy. And in this case, the court, or the, I don't know what the SAD is, some tribunal in any event, they said, look, mask, we don't know, but we're going to use the precautionary principle and say it's important to mask. Different kind of case when you're talking about putting a mask over your face versus injecting something into your arm, potentially where you don't want that injected. Okay, so different kind of considerations, but we can see the courts leaning a little bit towards this idea of let's take reasonable precautions. And then we've got the drug testing cases. So there's a lot of law out there about drug testing. And the reason I talk about this briefly is that drug testing is seen as a very invasive procedure, right? You either have to pee in a cup, or you take blood or some kind of other DNA sample or like physical sample, extremely invasive. There's a lot of personal information that can be carried in your blood or in your urine. And the courts have been very strong in saying that there's a significant invasion of privacy anytime you break the barrier of your skin. You have to be very careful when you implement those kinds of policies. And for random drug testing to be permitted, there must be a safety sensitive work environment. So high risk of serious outcome. If there was a drug use that caused us an event, and a demonstrated use or abuse problem in that particular workplace. So those two things are key factors in whether you can implement a random drug test policy because of that high priority or privacy interest. So, okay, what does that all mean? Well, here we have another cartoon. We want lesser restrictions, right? That's what we all want. Yep. I don't know why my PowerPoint is not. There we go. All right, so summary of considerations. Good faith. You want to make your decisions thinking about the best interests of your particular organization and your particular group of singers and all of the other people that are involved in your organization. Okay, so that needs to be your primary consideration. You're not doing this because you want to discriminate. You're not doing this because you feel like being arbitrary. You're making a good faith, reasonable consideration of what you need to think, what you need to put forward for you. What are your constituting or governing documents say? Are there any particular provisions in your constitution or in your bylaws that you need to consider? Think about the privacy considerations that I've just talked about. Think about that important fundamental feature of bodily integrity and free consent. Think about what the available science is. That's what we started off with our presentation today. Your rehearsal environment, not going to talk about that anymore. Demographics, we know about that as well. Your organization's values and purpose, that might come into things, right? Is your organization about the right to sing and bringing singing and the choral experience to everybody, regardless of their circumstance? Or is this an invitation to participate? You're an auditioned elite group, and your focus is a little bit different. What's going on in your specific community? And then at the very end, what is the minimal amount that you can do in order to achieve your bona fide, legitimate, and reasonable purpose? And so here's the practical slide. And if you're going to take a screenshot of anything, here's what you want to take a screenshot of, is the next 3 slides. So you're considering taking information about whether your singers are vaccinated. Here's what to think about. What data do you want? Do you want to know if they're fully vaccinated and when? You know, there was discussion about the possibility of needing a booster at some point. We don't know when the antibodies are going to maximize, and then if they're going to taper off, for example. So do you need to collect dates? Do we need to know if there's a difference between someone who is vaccinated in March versus October? Do you need to know what kind of vaccine that they got? Do you care if it's a difference between AstraZeneca and Pfizer? And then if you want that data, why? Why are you collecting it? Because you're going to have to answer the singers when they say, why do I have to give this information? So you've got the information. Well, what are you going to do with it? Are you going to keep it? Are you going to collect it in a database? Are you going to refer to it later? Are you going to take it and prevent someone from accessing certain aspects of your choir because they gave information that you don't like? What if you don't get the information that you want? So what if people just refuse to answer your survey? Are you going to prevent them from accessing your choir, or are you going to just look the other way? Are you going to enforce this policy? What happens if someone revokes their consent? So I gave you my information, but I don't want you to hold it anymore. I want you to delete that information. Are you capable of deleting that information? And then what is that going to do for that singer's participation? How are you going to manage the data? What's your storage system? What's your firewall? What's your protections against hackers and viruses? Are you going to disclose that information, and to whom? If you're not going to collect it, or if you're still thinking about whether you should collect it, is there going to be consequences for not collecting? Are some of your singers going to say, I want to know if the person next to me is vaccinated? Are you going to tell them? Are you just going to collect the information and say, yeah, 80% of our singers are vaccinated, and disclose that aggregate information? Or are you going to tell them, yeah, the singer next to you is vaccinated? What's the time frame for your review of that plan, right? So science is changing, information is changing. I think you need to have a 6-month, 1-year review protocol to make sure that the information that you're collecting is up to date and accurate, and still needs to be collected. And how much what are your resources for dealing with all of that information? And then, so you've decided that yes, it is worth it. We are going to collect that information, and we also actually want to know and say that everyone has to be vaccinated in order to join the choir. Well, you need to answer all of those questions from the last slide, but you also need to think about addressing requests for accommodation. Someone says, my religion prevents me from being vaccinated. Okay. Do you want to know what their religion is? Do you want proof that that's a genuinely held religious belief? How are you going to assess that information, and who is going to do that assessment? And then what kind of accommodation are you going to offer to that person? Is it going to be you rehearse via Zoom? You rehearse way off to the side, masked and away from all the other participants? Does that involve some kind of othering for that person that's now been pointed out as someone who has a particular religious belief or disability that might be highly private, and they don't want to disclose the fact that they're allergic to an aspect of the vaccine, for example? What are you going to do about people who do not require accommodation but otherwise refuse? So this is your, I just don't like putting chemicals into my body kind of objection. Are those members litigious? Are they likely to complain about you in some kind of legal process? And are all aspects of the privacy of the policy rationally connected to a reasonable purpose? And I suggest that you think about all of these questions before you write your policy. And I suggest that because you want to have answers before you start reinventing the wheel. If you're doing it backwards, you're doing it wrong. You're not doing it from a place of good faith. You're not doing it from that place of rational connection and reasonableness. So I suggest you really think through all of these aspects and make sure that this is the direction that you want to go before you go there. And that will make a defensible and a policy that will be upheld if it is challenged. Really briefly on, this is the case about rules. And if you're going to have a rule put in place by an employer, I think this applies equally to an organization. But again, it's just an analogy. It's not a legal requirement for an organization. Policies have to be reasonable, clear, unequivocal. You can understand them. You have to tell people that this is the policy and allow them time to comply. They must be notified of what the consequences of breaching the policy are. So if you're not vaccinated, then you will such and such, and consistently enforced. So you can't make exceptions for someone because you like their voice and you need them to lead the tenor section. I know that waivers are an issue for some of your groups. And so I know I'm running out of time, but I do want to spend a little bit of time talking about waivers. Waivers are complicated. The law about waivers is, there's a lot of it, a very large body, and a lot of waivers are tossed out at the outset. Some waivers, probably a minority of waivers, are upheld. And those that are upheld are very clearly drafted in clean and easy to understand English, not a bunch of legalese, not written in this tiny little print that you read on your cell phone before you download whatever app that you want to use. Okay, so something, 4 points, clear English language, easy to understand. And you have to give people the opportunity to review and review that waiver and understand that waiver, ask questions about that waiver, possibly seek legal advice about the implications of signing that waiver before they take steps. So, not the, that this is, you already rented the car and you've already paid for it, and here's this book that you have to sign at the desk. That's nonsense, right? I'm talking about something that, okay, you're interested in joining the choir. Okay, before you say yes, here's a waiver that I'm going to ask you to sign, and you have an opportunity to read it, ask questions about it, and then if you feel that you're comfortable in accepting that language, sign it. Okay, fine. A lot of people will say, yeah, I don't care, I want a waiver. I think waivers are useful because it prevents people from suing me because they think that they're not allowed. True. Anyone who says, oh, I'm really mad that I got COVID from choir, I want to sue my organization, and then the choir says, oh, but you signed a waiver. Okay, yeah, that's probably going to take maybe a few people and who are just going to say that really sucks, and they're going to go away. Some people are still going to sue, right? You can never prevent people from suing. What you can kind of try and prevent is recovery, but that's a little bit of a, when I mean recovery, you can prevent them from getting money out of your choir, right? But it's kind of an icky way to set up a choir relationship, I think. That's a personal opinion, not a legal opinion. But if you're concerned about if your waiver is going to be upheld, asking your singers to sign it, I think presents a little bit of an ethical or optical dilemma, and you want to be real careful about whether you're going to do that if you're going to. And one way to get around that is maybe consult with a lawyer on your particular circumstances and the particular waiver that you're asking your singers to sign. But if you're just doing it because you want to say, hey, look, this is what you're accepting, you don't need to do that as a waiver. You can do that as a, hey, there are some risks here. You're choosing to participate. Welcome to our choir. A small offside, if anyone is in British Columbia, there is a legislative provision that says that people can't recover for injury obtained from COVID in a transmission event in the normal course. So that's part of the emergency orders. It lasts as long as the state of emergency is going to last in BC. No other province has that protection. So BC folks, you really don't need a waiver unless and until that legislation is lifted. There's similar legislation in care facilities in a few other provinces, but they don't apply widely. Venues, I'm just going to say this, it's out of the scope of the presentation, but don't let the venue dictate what you need. Do your own thinking about it. And that's what'll keep you on side for being bona fide and reasonable. And then, why are you doing this? Thinking about the possibility of complaints, thinking about the possibility of potential injury to your singers, decimation of your choral, of your group if everyone gets sick or something like that. Just be careful about that. Publicity and your choir image, right? Yeah, you don't want to be the first choir that everyone knows about that shut down choir singing across Canada either. I get that. And that's a real consideration for everybody. Really briefly on insurance. Insurance is probably not going to protect you unless you have a specific insurance policy. So read what your policy says and watch for these kinds of words: force majeure, acts of God, communicable diseases. Those are probably going to be found somewhere in your limitations and exclusions part of your policy. So be careful. And when you're renewing, there's going to be a change there. Everyone is going to be excluding COVID. It's just the way that the insurance industry works. Remember that you have to review whatever you do regularly, and flexibility is going to be going to serve you well, probably more than certainty, just because of the way the pandemic is evolving and how we have to adapt. And hopefully we can get singing in person, in the same room and in the same space, and not on Zoom, because everyone's real tired of Zoom. And that is it from me. I'm sorry, I was a little over time.
Allison, thank you for all this information. Yeah, like I said, the restart is so much harder than the shutdown. But thank you so much for all of that information. Now we are going to welcome singer, conductor, and lawyer Margot Nightingale from Yellowknife. Welcome, Margot.
Thank you, Morna. So thank you for inviting me to participate today. Merci à Canada Choral d'avoir réuni ce groupe pour présenter aujourd'hui. Ma partie se concentre sur le partage de l'information et la communication. C'est donc avec un certain regret que ma présentation est en anglais. Je regrette. I do want, though, to acknowledge that I'm joining you from Chief Dry Geese Territory, which is the traditional lands of the Yellowknife, Dene, and the North Slave Métis. From this beautiful land, I actually conduct a community group of, so I just need to change my view here, a community group of singers called Aurora Borealis. We are a non-auditioned group of singers aged from about 14 until 75 plus. Now, in this group, we come from all over the place. Our choirs, our communities, our experiences of the choral event and the COVID impact has been very different. Our public health measures are different, and the responses have been different. The only thing we really share was the effect of the complete shutdown that occurred in March 2020 and the loss that created. Now, I was asked to do this presentation because with sheer stubborn determination, our organization was able to get an exemption to what were very restrictive public health measures that prohibited the singing indoors and to some extent outdoors until such time as there were effective treatments and vaccinations available for all. At that time, we thought it could be years before that stage was actually accomplished. So getting the exemption, it was not an easy process, and sometimes we wondered if all the caution was truly necessary, and we still have wondered that from time to time. But our COVID stats help to show that the restrictions that we did take were part of a larger and more important territorial approach to protecting not just our singers, but our community, and eventually those that do border on our borders as well. So we also know that our application to get this permission was made in different ways by different groups. We know that churches were asking to sing inside. We know that schools were asking to sing inside. And most of those groups were actually refused in their requests. And in large part, that is because the public health officer did not see the level of attention on the variety of issues that needed to be addressed, predominantly a recognition of the risk that exists and is present, particularly when addressing singing in a group. Now, I think it's helpful to situate us a little bit in where we are and what our conditions have been. I'm from the Northwest Territories, and when we began our work to get exempted from the public health prohibition, we were relatively unaffected from the virus. Now, we have 33 communities in our territory. It's a vast territory. We have about 45,000 people living here. About 50% of them are Indigenous, and we do have 11 different official languages that reflect that cultural diversity. Our capital is Yellowknife, and that's where I am, and we have a population of about 21,000 people, and about 25% of them are Indigenous. So when we began, we had between March and September 2020, 10 cases. Between September and December, we got up to 35 cases. By April the 30th, which was the end of our season in 2021, we had a total of 84 cases. We then had an outbreak in an elementary school, and to date the number is 170 cases, with a single active case today. We've had no spread during this outcome, so all of the source of the virus has been traced back to travelers, and we've been very fortunate in that we have had no deaths to date. In some ways, we feel very closely connected to New Zealand, except when the circumstances improved in their case counts and numbers, their restrictions lifted, whereas ours tended to continue. Oh, I'm getting ahead of myself. We had a really cautious chief public health officer. She took a fair bit of abuse as a result of the measures that she put in place, but you'll see this list of measures that has been applied pretty much across the territory. One piece that's missing that was also central to containing the virus from travelers re-entering the Northwest Territories is the use of isolation centers in each of the 3 hubs where there is in fact a hospital. So our quarantine rules have just been eliminated for fully vaccinated residents and have been reduced for partially vaccinated residents. Our mask mandate ended yesterday, and our border, while still guarded, is becoming more open. But as everyone knows, and you've heard from other speakers today, it doesn't take much and it doesn't take long for the virus to get the upper hand. We've seen in the Yukon and in Nunavut particularly that there have been some very quick and stark changes of condition. And as we are still trying to understand the variants of concern and their impact, we just know we can't get too comfortable and too cocky yet. Now, in some ways, all of this information probably makes us pretty unrelatable to most of you. This is not the reality that I understand the rest of the country has actually been experiencing. But to some extent, that makes us a bit of a microcosm and can sort of show where you're headed if things continue in the direction that we're on right now. There is still very much a risk, but that risk has been reduced to something that we have been living with for the last year. We've shown through the process that we've used that it is just a larger it's a larger obligation to consider not just the safety of our singers, but how that does actually influence the safety of our communities. So overall, my goal today is to give you a brief overview of what our process was and what we did to involve our singers, communicate our message, and try to ensure that we had a plan that people accepted in large part because they understood it. So we did draft a plan after considerable research and review and reflection and consultation with our public health officers. And it's important, I would suggest, to consider these 3 elements when you're putting your plan together. It is crucial to discuss risk, and it is crucial to do so in a way that your singers can understand why it is this matters. In that way, they'll better understand the mitigations that you're recommending or requiring are going to apply in your circumstance. And throughout the discussion and considerations, don't ever forget what your choir's main goals are, and whether that's to have fun or to make a specific contribution to your community, or in some other ways achieving some higher excellence in performance and musicianship. These are all still things that should be reflected in your plan. So when you are thinking this through and planning on sharing it with your singers, it's really important to share with them some form of summary of the risks of singing. This is pretty much what we shared with our singers. Not all of them have been following the science, not all of them have been following the news. And what we want to make sure is that we're working from a common understanding of what some of those concerns are. Now, these elements reflect what we know about the risks of singing generally. It doesn't account for the changes in that risk calculation that we can now make because of the presence of vaccinations. and because there are some more successful treatments for the COVID virus. That said, singing hasn't changed. We are still needing to reflect on these risks. It's just the impact of singing that has changed. Even there's some impact we don't know yet. For example, we really don't know with certainty if a vaccinated person can still spread the virus. So all of these risk factors are still quite valid and important to reflect on and to ensure that your singers understand. It's also important to put this into your current context. You're going to need to do some work to figure out what is this information, your local level details. And so I'll just leave that with you to sort of ponder. The one I want to emphasize is just keeping in touch with your public health office and making sure that you're always aware of what measures are in place and what directions are coming from them. If you're wondering where to find this kind of information, then you can actually just scan this little QR code, which I found, which will bring you to the link that I've highlighted at the left of the screen. And from there, you'll find a variety of links for each province and territory, which will take you directly to the data collection points. It's kind of a fun thing to have available. Now, when we talked to our singers about what we were doing when we came back together, it was important, again, to categorize the existing risks, and in a way that we could link then our mitigation measures directly to those risks that we were aware of. So we categorize them in 3 ways, and you'll see them here. There's a risk that comes from close proximity in a rehearsal. There's a risk that comes from the production of droplets and aerosols. And then there is the risk that comes after you've actually been exposed. So we prepared a series of slides that we shared with them in a Zoom meeting early, I guess it was about a month before we returned to singing together. And in that, we took each of those risk factors and we told them, this is what we need to do to address each of these broad risk areas to keep each of us safe. So we did end up needing to social distance, to wear masks throughout, to make sure that we had a big enough venue, to reduce our number of singers that were present, and ultimately, just to be aware of spacing differences that occurred between people facing forward and and people actually singing towards each other. So in our circumstance, I was the only one and the accompanists were the only ones that were allowed to actually face the singers. And as a result, we had a larger gap between us. And as a result, well, it's not a result. What was surprising was that in our working with the public health office, while everyone needed to be masked, there was an exception that was made for me as the director. I was allowed to wear a face shield during the rehearsal. It may be because our liaison was somebody who is very familiar and well connected with choirs and has been a chorister and a conductor in the past, but it is questionable whether that was really providing as much safety as you would want if the situation in your community was much more serious than it was here. But given our context, given the circumstances of the virus in our community, it was considered a reasonable modification to the mask rule. And so you might be able to achieve that for yourself, you might not, but it is clear there's advantages if the conductor can actually show their face and be seen by singers as you are working through your repertoire. This is another slide that we presented to them to explain the steps that we were requiring for addressing the production of viral particles. And ultimately, we were required to reduce the length of our rehearsal from 2.5 hours to a maximum of 1.5 hours. In the end, we reduced it to 1 hour and 15 minutes. We were only allowed to sing fully for the last 30 minutes. You'll see as well that we eliminated our social time, so there were no snacks, and we were requiring everyone to come with their own gear and not share. Finally, we gave them this slide, which highlighted some of the sort of more environmental pieces that we were going to be putting in place and that would influence the singers. I notice in the first point here, like we want to draw you back to the comments of Dr. O'Keefe and how she was describing the importance of airflow and ventilation. Some of that can be a little bit mind-boggling. We relied on a much larger facility with a modern air exchange system, which we understood from building specs, that there needed to be at least 3 air changes per hour in the system that was in use in that space. And so we felt that that was an adequate protection, and we didn't include any other measures to address ventilation. But you'll see these other elements were also quite important. Now, there are some wild cards now, and I just bring them to your attention as things you'll need to think about. We don't know where things are going with variants of concern. We don't know what the impact of vaccination and the potential for a lower or uneven uptake is going to have. We do have already some sense for both, and just as we do have a sense that misinformation is a significant concern. And in this conversation, part of what we do in communicating information to our singers is combating that misinformation, bringing us to a point of common understanding, common awareness, and like critical awareness of those points that do help to ensure a level of safety, a level of confidence, and a level of common purpose, if you will. With respect to vaccination, a lot has been said already. I know there's a lot of questions that came through the chat about, can we ask, can we require it, what do we do? I just encourage you to think about the information that's been shared in the previous presentations. This is not an easy question to address at all. There are a lot of pitfalls, one way or the other. The encouragement that I would give you is simply to consider, how will you apply this, and can it be done in an equitable way? Can you ensure that you have enough support in your organization and in your leadership, whatever your plan will be, that you are prepared to address anybody who comes forward with a concern, either their concern being that they don't know who they're singing next to, or that they do know who they're singing next to and they're not comfortable, or that they've been excluded and they're uncomfortable with that. So from my perspective, I feel it's fair to say that I have a bias here. I am not going to be asking my board to require vaccinations. I think that vaccination is a game changer, but it is one of many measures that we will require to keep us all safe. I think we sometimes assume that if we're working all vaccinated, all of us together, that then no other measures are required. I'm not sure that's accurate. Time will tell. We do know that national organizations in the US and in Canada have taken some time to make statements about this. This group of organizations, you'll see them all up here, have decided that they're not mandating vaccinations, they're encouraging vaccinations. And they're also encouraging that specific steps be taken by people who are not yet fully vaccinated. On Friday last week, the Public Health Agency of Canada also came out with guidelines. And these are the kinds of tools that you can share with your singers as well to show whatever rules and approaches you are applying relate back to existing guidance from public health authorities and organizations who have been studying these issues throughout the pandemic. Now, this infographic that you see on the right, it is the first column on the left is just telling you what kind of activity they're considering their guidance relates to. The second you'll see is what they suggest for people who aren't fully vaccinated or aren't vaccinated at all. And this third, which may be blocked by my picture, I can't really tell, is what people can do if they are fully vaccinated. You'll see there's a lot of green on the right-hand side until you get to the bottom. And the bottom is the one that's going to affect choirs, in my opinion, the most. Because as you'll see, the activity there relates to indoor activities with people from multiple households who are unvaccinated, partially vaccinated, or their status is unknown. They refer in particular to worship services, and in that way, I think it's quite analogous to our choir rehearsals. So you can see that there's a red warning for folks who are partially vaccinated or not vaccinated. And that is an important thing to bear in mind, reflecting too that even if you're fully vaccinated, it's not a green light to go ahead. So they haven't mandated vaccines for any of these activities either. They are largely using this tool to recommend various measures, to warn, to advise, to encourage awareness of ongoing risk, and to suggest some measures to address that risk. Now, there's one part of this infographic that couldn't get shown on the first page, but this also could apply to choirs, potentially larger groups, maybe if you're actually performing. And you'll see again, just as a quick glance, it's not green and green, but I'll leave it to you to check that out and review it. This text at the very bottom too needs to be reflected on as well. You'll see that public health is still saying we got to do all these other measures to wash our hands, cover our sneezes, and make sure we've got some pretty good ventilation. So those are helpful just to see that these organizations haven't mandated anything. They are moving towards encouraging us to pay attention to what we're doing, what the possible risks are, and what can we be doing to reduce those risks. Vaccination is one part, but it is only a part. So when you're figuring out what's your plan going to be, it's really important to look at these elements. They've been raised in some of the earlier presentations as well, but you do need to think not just in a global perspective, but in your circumstance, what is required. You'll know some of this, but there's a lot that you won't know. And this is where one of the really helpful communication pieces we used is relevant. Where we don't have information largely is around individual singers' risk factors, individual singers' risk tolerance level. And that's where we used surveys to better understand what our singers' perspectives were. Surveys are helpful for a ton of reasons, particularly at a time if you're like me and you're feeling very disconnected from your singers and your group. It was a really meaningful way to reach out to them, but perhaps the most important outcome was that it was a way to engage them in developing this process, in fleshing out the process, and in doing that, it encourages buy-in and builds confidence in what you're doing. We stretched our surveys to include a variety of facts that we wanted input on to better understand what people's intentions were. Knowing that our choir situation was going to be different, were people actually interested in participating? Were they going to return to sing? Were they going to adopt whatever measures we said we'd ask them to? And in our most recent survey, we did ask them what their vaccination intentions were. So you can use your survey to tailor to whatever concerns you are grappling with and you think that you'd like to get some feedback from your singers in a safe and supportive way. You'll see there's a few other things that we did in our surveys. You can modify your surveys however you like. You've got choices with your surveys. Some people were asking about the difference between asking people to identify and share their information, connecting their information to their name. In our surveys, we chose to go the anonymous route. That was largely as a reflection on why we were asking this information, what we wanted to use it for, and we wanted to encourage a more open and honest sharing of information, and it seemed to us that an anonymous survey was more likely to garner that than otherwise. There are some suggestions about different platforms that you can use for surveys, but overall, it's really important to make sure your questions are clear. So do a limited test run with your board or some other small body, just to make sure that the responses you get are actually ones you can interpret successfully. It was surprising, actually, some questions came back with answers that's just like, I don't know what that means. So it required going back and fixing that. Ultimately, you want to make sure that you're just collecting the information you need and not more. If you're curious about the surveys that we did, I've given you some links here to the surveys we did in June 2020, and then again at the end of our last season. Once you get that feedback, it's really important to reflect on that and then incorporate as much of that helpful information as you can in your actual plan. You'll see there are some other elements to bear in mind and to consider. Your plan needs to be really clear about what measures you are going to require and why. Your plan should be also very clear about what expectations you have on your singers and why. And also identify what the organization is going to do to support this plan and to support this notion of keeping people safe. Whatever you can do to detail the logistics for the season as well just helps, again, encourage singers to keep moving forward and staying involved and engaged. As part of this process, you will probably also need to review a variety of materials that already exist. So you can see I've sort of limited that to registration materials, because registration materials is sort of your next point of entry and next point of sharing information to your singers about what's going to be happening and what they need to do. You want to consider whether you actually want to make the full written plan available to your singers if you want to condense the information in some way. We did both. We had the full plan available to them. We also had a condensed statement about the singers' commitment to safety and the new steps they were going to be required to follow. That being staggering their entries and departures, staying 6 feet apart, wearing their masks, etc. We were also actually required by the Workers' Compensation and Safety Commission to actually incorporate some specific risk assessment tools that they require of all employment sites. Even though we're a volunteer organization, there's a questionable legal connection there, but honestly, this was not the time or place to have that conversation. We wanted singers to be fully aware of what the potential risks were and what the steps were to mitigate against those. So we didn't really want to argue against that point, but you may want to be aware that could be a thing where you are. Waivers have been discussed a little bit too, and although there's lots to debate about waivers, our Chief Public Health Officer told us we needed that. So we developed one, and we did our best to make it clear and plain and simple, and everyone signed it. And nothing bad happened, which was also great. The other thing to bear in mind is you just need to keep checking in with your Chief Public Health Officer and make sure that your requirements are in line with what they're doing. There's other administrative steps you probably want to consider and then share with your singers. Are you going to require them to register in advance of attending? Some choirs let you sort of check it out for a few weeks and then decide. In our case, we felt that wasn't safe anymore. If they wanted to check it out, they could attend by Zoom. Otherwise, to attend in person, they needed to complete all of the necessary paperwork, and they needed to be, in that way, fully informed of what it meant to come in person. So we did have them also review the new commitments that were placed on them. We did have health checks that were done before every in-person rehearsal. We did a Google form that was quite easy for people to access and complete, and I've given you the link there if you just want to see what that was like. They were asked to fill that in just before coming to rehearsal sometime that day. Sometimes people would fill it in as they were walking in the door. Not ideal, but at least it draws people's attention to whether or not they really should be at choir that day. We also encouraged a digital sign up. At the beginning, it was necessary because we had more registrants than we had spaces to sing, but then it became a great tool. If we were ever asked to do contact tracing, we could look up the digital sign up to see who was actually there. You may also want to use a seating plan. Again, that's with the idea of figuring out if there is any kind of exposure in a choir rehearsal, can you show that exposure to be more limited to those folks sitting around? So a seating plan can be a helpful tool in that regard as well. And then finally, it's really great just to consider, like, what records are you going to keep? How are you going to keep them? And who's going to keep them? And I refer you back to the presentations you've already heard that address that too. Once you've got it all figured out, you've done your plan, you've got your survey, you've got some feedback, you've finished your plan, you now know what you're going to do, it's helpful to go back to your membership again and let them know your feedback was great. This is what we did with it. So what we did is we actually had a Zoom meeting where we convened all of our singers that were available to look at a fairly lengthy PowerPoint presentation, which took them through what were the survey results, what were the new approaches that are going to be used for the board, for the singers, what are the obligations. We highlighted our priorities and we highlighted the changes. We made it as clear and engaging as we could. We used pictures of them singing before. We used little clips of videos that we found on YouTube. Probably the most helpful were the ones that helped to show that singing with a mask, which people were very leery of, didn't actually make much difference to the actual outcome of your singing. Singing could still sound very beautiful. The other thing that those videos showed, and we had some specific ones that came out of the international study, that singing without a mask showed quite a lot of aerosol being created, and that singing with a mask did quite a lot to actually contain that. So they were great visual little tools, 30 seconds, not much more, just to help demonstrate some of these points, because we all know sometimes we believe what we see better than what we hear. The final point on this opportunity to connect with your singers is to expect and respect mixed feelings. We know a lot of people are feeling fantastic now that they've been vaccinated. We also know that vaccination has still left some people feeling uncertain and unsafe. We still know folks have a lot of questions in general. So allow for that. Let it be said. If you're not sure how to respond to it right away, that's okay. You don't need to respond right away, but it's good to at least take that back, reflect on it, and figure out, does something need to be adjusted further? How can we address this in a way that is fair, that is transparent, and that is in whatever your core values are of your organization that respects that? In our presentation, we asked singers specifically to commit to keep each other safe, to apply new health rules, and to be brave. This was a slide we gave to them, and it was actually just before showing them a variety of pictures of masks, telling them, yep, we're going to be masked. We also created a bunch of tools that we made available on our singers website, and we gave them a slide just to say, we've done this for you. We want you to follow up and take responsibility to follow through. We also gave them a slide that just gave them some very direct advice about what to do if they were feeling sick. If it was before a rehearsal, stay home. If it was after a rehearsal, then there's more specific information you probably want to tell your singers so that they know who to call and what to do. Finally, close to finally, you should be prepared for sudden changes. When there is a sudden change, anticipate there's going to be some heightened anxiety around that. So review your protocols and see, do they measure up to that change? Are they going to get us through this as we are, or do we need to make our own adjustments? Once you've made that decision, then reach out to your members. Do that as quickly as you can, as clearly and consistently as you can, and ultimately be available for them to ask questions and to follow through. So in terms of who's to be available, as a choir leader, you're perhaps the first person that people are going to reach out to. You should hope to have members on your board who are also going to be available, who can also provide the same message of reassurance or clarity that is required. And finally, what did we actually learn from this experience? Well, our registration numbers actually remain pretty consistent from previous years. Our youth choir, which was also allowed to perform in much, or to rehearse, sorry, in much the same conditions and with much the same mitigations, had a slight decrease in numbers, but our registration was solid. And members remained committed, and they were so grateful. Oh, the feedback that we got from singers was so encouraging and uplifting. We asked specifically how they found it to modify a rehearsal process. And what was interesting is that the most difficult element was adjusting to singing 6 feet apart from other people and in a venue where they weren't able to hear each other very well. So singers join a choir because they don't want to be a soloist, but they all felt like soloists. It was hard for them. And so we just have to appreciate that that could be happening to your choir too, if this is the approach that you end up deciding to use. The next most difficult thing to adjust to is the fact that they didn't like being limited in how much time they could sing. Not surprising. And they didn't find it easy to hum, which was surprising. 21%, only 21% found it hard to adjust to singing to a mask. There were many who said it wasn't hard at all. So all of that is just to say that we have a lot of work to do. It is not easy, it is not straightforward, but you all have the tools available from the information provided by these presenters and studies that have been done over the last year and a half. You have the ability to figure out what is it that you need to be able to rehearse safely together again. How can you communicate that in a way that your singers will understand that you are looking after their best interests and your community's best interests? Those are such vital pieces of the puzzle that someday, soon, we hope we'll be back to this kind of performance once again. And I just want to say thank you to Choral Canada for making this happen. So thank you.
Thank you so much, Margot. It was wonderful to close this up on such a personal level and thinking about how our singers feel and how we as an organization want to keep them safe and keep them informed. We are woefully behind schedule with all this fantastic information, but we are going to go to the Q&A. We understand some people may be leaving. We will still do the random breakouts at the end, but this recording will be available online as well. So I'm going to turn over to Megan. I want to thank all of our presenters. I'm going to turn over to Megan right now for the Q&A.
Thank you so much, Morna, and thanks everybody for your patience. So a lot of the questions you've had have been answered in the chat. Thank you so much to Dr. Mcgear and Dr. O'Keefe and Margot and to Allison for taking the time to do that. I really, really appreciate that. Incredible presentations and a lot of time went into the presentations. Thank you so much. So we will be sharing what's in the chat. We will create a summary, so you'll get those answers. We can't ask every question that you had, but what we'll try to do is just do a few. So Dr. Mcgear, this one's for you. And I think this is a big question for everybody. What is the risk to vaccinated people when there are unvaccinated people in the room and we are singing together? Do we have enough information? Do we know at this time?
So the correct answer is it depends, right? It depends on what mitigating measures are being taken at the time. It depends on whether we're talking, which variant we're talking about. It depends on whether the person who's unvaccinated, it depends on the risk that the person who's unvaccinated has COVID or is incubating COVID at the time. And the really difficult part about this, of course, is that what you're worried about are super spreader events, right? The particular circumstance in which you just get this unlucky congruence of a circumstance where for some reason measures aren't being adhered to carefully and a person who is highly infectious and usually doesn't know it, right? I mean, the problem now with unvaccinated people is not in general that unvaccinated people are going out when they're symptomatic. It's that you transmit this disease before you get sick or when you're not sick. And if you have the misfortune to have a person in your group who is shedding high quantities of virus, then you can have a problem, even though most of the time things are going to be fine. So the key issue that we're looking for in order to assess the risk of vaccinated and unvaccinated people sort of being together, the risk to vaccinated people, is that question of how well the vaccine protects people against the Delta variant. We know it's imperfect. So we know in nursing homes that nursing home residents who are vaccinated are very well protected from exposure to staff who are unvaccinated and ill, if it's the original variant or the UK variant. But they are not completely protected if it's one of the other variants, including the Delta variant. So we don't know for sure what the level of protection is for younger and less frail adults. And pretty much anybody who's singing in a choir is younger and less frail than the rest of the nursing home. So, so that's the key piece that we need in order to assess whether we need to keep up the precautions and the exclusion of people who are unvaccinated, at least some of the time from choirs, or whether we can say, no, it's okay. If you're vaccinated, you are well enough protected, and it's all right if there are unvaccinated people around. That might be true. It's just we're not going to know that for 3 months, I guess.
Thank you so much. Yes, that answers a lot of the questions. And I think a lot of people came here today wanting to know the answer to that. And the answer is that we just don't know yet. And we still need more information. So moving forward, we need to be planning to continue the other ways to mitigate risk, such as our masking, our distancing, our shorter rehearsal periods, is everything that has been discussed today. So that's great. Thank you so much. The next question is going to be for Alison Trombley. And Alison, you did respond to this in the chat, but I just want to have you reiterate it one more time. Can people mandate vaccines? Can they require them? Is there any law that says you cannot do that? And is it provincial or territorial? If you could just answer that question, that would be great.
So there is no law currently that says that we can or cannot mandate vaccines. So there's no law about that. And quite frankly, I don't think there ever will be. If there is a law, it will be that you can't, given the current political climate. That would be my suggestion. However, just because there's no law doesn't mean that you can't do what's best for your organization. And that's why the last few slides of my presentation, when you review them, have the practical considerations of what to think about when you are putting together your return policy. So if you do, after considering all of those questions, decide that your organization has a risk profile, and you want to minimize the risk, and you think that it's appropriate to do so and reasonable and bona fide, you're doing it for good reasons, not because you personally are scared, but you've thought about the transmission rate in your area, you've thought about the particular makeup of your group, you've thought about your purposes of your organization, all those things that I had in the little boxes, and you've gone through the questions and you say, yes, this has led me to a place where I feel, and we feel as an organization, that we require vaccines. I think that you're going to be well served having gone through that exercise if and when someone makes a complaint. So you can never prevent someone from complaining. There's always going to be some person who has too much time on their hands and feels like sending letters, or maybe they're going to sue. I don't know. I can't tell you that you can prevent someone from suing, because there's nothing you can do to prevent someone from suing. What you can try and do is prevent someone from being successful in that suit. And I think if you've gone through that exercise, you will be well served. Now, you might end up with a decision maker who makes a different choice, but they're going to do so and say, you know, they thought of all of the things that they should have. I'm just going to reach a different decision. And that might happen. I think the risk is very low. I hope that answered the question. There's no specific law. Think about all those things, make your decision, live with your decision, and hopefully your singers and the courts, if that gets that far, will support you.
Okay. A quick follow-up to that, just for clarification. So if your choir does decide to have a policy that you are going to require vaccination, can you ask for proof of vaccination legally?
Again, so if you're going to mandate and then you're going to ask for that proof, what kind of proof do you want? So again, that list of I think I had a slide with some bullet points of all of the things to consider if you're going to be requesting that, and what you're going to do with that information, how you're going to hold it and maintain it, and make sure that you're compliant with the privacy legislation of your province or territory. So review your Privacy Act, have a privacy officer who's going to be there to present, answer questions about the policy and the collection, and be prepared for those singers who will say no. What are you going to do about those people? Because they're if you're in a major center or if you have people who really value their privacy, if you're in a bigger group, there are going to be people who say, nuh-uh, I'm not giving you my medical information. And that's going to be a reality, I think.
Right. Thank you so much. And I think the key part there is that these things are also provincial or territorial, and you have to check in with your specific, where you are located, the laws around that. I think we'll do one last question just because of the time. And this is in regards to children's choirs. So this might be a question for Dr. Mcgear. You did touch upon this about that we still don't have a lot of information. So I think we're just looking for that, that final clarification. Let me just make sure I've got it. So is it at this point that if a conductor is planning for the fall for a children's choir under 12, right, so that they're not vaccinated, can they plan to be together with the safety measures in place or not? It's I know that a lot of it's going to be based on what is provincially mandated and what's happening at that time. But at this point, June 29th, can they be planning to open up in the fall and have their, safety procedures in place?
You can definitely be planning, and if it's not going to be September, then it's going to be November, December, right? This is going to end. Choirs are going to open. Kids are going to be back. So there, you can say, well, it's not going to be September, so we're going to delay planning. But honestly, you might as well do the planning now, because it might work in September. We don't know for sure. And if the planning's done and it's not September, then it's going to be October or November or December. It's going to be sometime. So I think it's a really great idea to do the planning now, to be hopeful that it's going to be okay in September or October, but to know that, the work's going to need to be done at some stage. And if it's done, then you're set and ready to go, and the children in your choir will be really grateful to you.
Thank you so much. So a final statement just for everyone here is that just continue to follow your local health protocols. That has been reiterated many times, and that if you want the opinion of Choral Canada, is that you need to plan to be cautious and to plan to have your mitigations of risk in place. And that one of the main ones is masking. There was a question earlier about masking before and during, the masking all the time, before you go in and sing and when you're singing. So again, this is based on the research that we know, the information that we have, and we're just doing the best to give you the best information that we have. So, but at the end of the day, you follow your provincial or territory health guidelines and make the decisions that are right for you in your circumstances. We wish you had an answer that answered it for everybody and was a blanket statement, but unfortunately that just does not exist at this time. So I will now pass it over to our president, Laurier Fagnon, for our closing remarks, and then we will split out into breakout rooms if you want to stick around. Don't feel like you need to, but if you really want to still ask some questions and talk, we will keep the Zoom open. Huge thanks to our presenters today, and I'll let Laurier will do the thanks.
Thank you, everyone, for attending today. I hope you're still with us and alive and invigorated. What a lot of information, what a lot of great information. J'espère que la fumée ne sort pas trop de vos oreilles avec tout ce qui a été partagé aujourd'hui, mais merci d'avoir été là avec nous. Thank you to all of our amazing and super generous presenters today, and to Kim Gucci for her very touching and meaningful opening, as well as to Morna and her team who planned this, and of course our superhuman Megan that we appreciate so much. We hope that the information and answers provided today will be helpful to you. Maybe you have more questions, but hopefully you got some answers and some valuable information that will at least help you to pose the right questions and be able to share the right answers with your boards and your members, and start to plan now in the best way possible. There was a lot of good food for thought, certainly. And Choral Canada will continue to be here for you. And the slides of today and the recording, Megan, am I correct, will be available on our website, choralcanada.org, by July 5th. So yes, have a look out for there. There'll also be a report from the University of Alberta study available by the end of July, and we'll get that to you as well. Interesting information and images on masking and masking versus no mask that could be very helpful. We encourage you all to get vaccinated if you haven't done so already, and to, of course, encourage your choristers to. And to consider becoming a member of Choral Canada if you haven't already. When you're looking for the recording of today, just go over to the membership tab and think about joining us. We love to have you around our table very regularly. Donc merci à toutes et à tous d'avoir été là avec nous aujourd'hui. On apprécie votre présence et espérons que ceci a été utile pour vous et vous aidera dans votre planification pour l'automne. So as Megan said, we'll now go into breakout rooms. Feel free to stick around. Feel free to leave. It's been a long session, but hopefully one that's useful to you. Thanks to all of you, and have a great summer and good luck for the fall.